Hello, my name is Eric Toy and I'm a student physical therapist assistant from South University. Today my patient is currently admitted at Tampa General Acute Care Hospital after suffering a Conus Medullaris injury following a motor vehicle accident. He has been having complications regulating his blood glucose level due to having been diagnosed with type 1 diabetes mellitus as a child. He lives on the second floor of his apartment that has an elevator, so our focus is preparing him to return to his home in a wheelchair and educating him on sensory loss. He is currently in the maximum phase of recovery and requires standby assist. The patient has no loss in motor control in his upper extremities and trunk. However, he has no motor control in his lower extremities other than limited use of both hip flexors, which have a 2 out of 5 strength. Conus medullaris presents with lower motor neuron symptoms at the level of injury and upper motor neuron symptoms below the level of injury. Since his injury was at L2, I will be testing his hip flexors for strength and his knee extensors for range of motion and spasticity. The conus medullaris is the most distal bulbous part of the spinal cord, situated at the level of L1, L2 vertebral bodies and compromises of sacral segments of S1 through S5. Signs showed involvement of saddle anesthesia at S3 through S5, absent bulbocavernosus reflexes at S4, S5, and absent anal reflexes S4, S5. MRI is almost invariably indicated for diagnosis. However, CT and catheter angiography may also be required. Some precautions to take into consideration are possible bowel dysfunction, development of wounds due to decreased sensation secondary to his conus medullaris injury, as well as diabetes, spinal instability, need for medical support, and to check his blood glucose labs before and during treatment to evaluate for hypoglycemia. The short-term goals for my patient are to increase hip flexion strength to 3 out of 5 in 2 weeks, and to transfer to a wheelchair independently with a slide board in 2 weeks. I plan on introducing exercises to strengthen his hip flexors and to prepare him to transfer to a wheelchair independently and provide him with a home exercise program that will address these limitations as well. The patient is currently unable to transfer out of bed independently and requires the use of a wheelchair for mobility. Good afternoon, Mr. Gainey. My name is Eric. I'm a student physical therapist assistant from South University. It's going to be working with you today. Is it okay if I call you Joe?
It's fine.
All right. Today I'm going to take some measurements of your legs and to see how much strength you got, see how much range I can move some of the joints in your legs, and to see how much tone you have in your muscles. Okay.
Okay.
I'm going to be also showing you some exercises to prepare you to get from where you are now to the side of your bed, as well as into the wheelchair on your own. All right. I see that you are medically stable right now, and your blood glucose labs look normal. If you're feeling any fatigue throughout the treatment, let me know. We'll stop and retake your glucose labs or your blood sugar and see how it's doing. Okay.
Yeah.
And remember, we're not trying to strain or hold your breath throughout the treatment because we don't want any unwanted bowel movements. How does that sound?
Sounds good.
All right. And just to confirm, you haven't had any falls since they've been in here last?
No.
Okay, and you're not feeling ill at all?
No.
Very good. Do I have your permission to begin the treatment that I've described?
Let's do it.
All right. Before we get started, are you in any pain right now?
No.
No? Okay. How have you been feeling since the last visit?
Pretty good.
Pretty good?
Yeah. I've been like a little tired earlier today,
But how are you feeling right now?
feeling good.
Good, so you're not really tired
No.
anymore. Awesome. And then, have you had any changes since last visit?
No.
No? Are you is your upper body feeling stronger at
Yeah,
all?
upper body's feeling pretty good.
Nice, okay. Well, we'll definitely keep an eye on the fatigue, like I said earlier.
Okay.
And if you're having any pain throughout the treatment, just let me know and we'll go ahead and tailor it back a little bit, okay?
All right.
And I know this is probably not what you imagined what you'd be doing at 23, but
Not
you
at
just
all.
got to keep your head up, keep pushing forward, and just looking at the next goal that's in front of you and just reaching that goal and then move on to the next one, alright?
Alright.
Alright, Joe, now I'm going to test the strength of your hip flexors. So what I want you to do here is lift this knee up as high as you can, okay? Alright. Now I'm going to come over to this other side. I want you to do the same thing. Lift this knee up as high as you can. Alright, because we weren't able to get all the way up through as high as your body can go, I'm going to put you on your side and we're going to try it again, okay?
Okay.
Alright, Joe, so we're going to do that same motion, just like we did on the left leg on your other side. And I saw that you were able to move the whole range with your knee. We're going to do that same thing with the right. So I'm going to grab under here, and I want you to bring your knee as high as you can, okay? Good. Okay, now we can relax. Okay. So that was a 2 out of 5. He was able to move you were able to move the whole range in a gravity minimized position. Alright, Joe, now I'm going to take some quick measurements of your knee and see how much motion you have in your knee, okay?
Alright.
I just want you to be relaxed as possible and let me know if you're having any pain at all throughout it, okay?
Okay.
So first I'm going to see how much your knee will bend. So that is a soft end feel. The fulcrum will line up to the lateral condyle of the femur, the proximal arm to the greater trochanter, and the distal arm to the lateral malleolus. And that is 135 degrees. Okay, I'm going to place this towel underneath your leg, okay? Good. So that was left knee passive range of motion extension, 135 to 10 degrees. Here. And that was a firm end feel on that for extension. This is a soft end feel. Good. 135 degrees. All right. So again, firm and feel. It's 10 degrees. So right knee passive range of motion. 135 to 10 degrees. So all that means is you have a little bit of work to do for extension. We're trying to get that down a little bit, okay?
Okay.
All right, Joe, for this next test, I'm going to see how much resistance your muscle has as I move your leg, okay? Again, I just want you to relax, and if you're having any pain at all, just let me know and we'll stop it, okay?
Okay.
I already assessed his right knee extension for Ashworth scale, and it was a 2. And now I'm going to test his left. So just want you to relax. Okay, how are you feeling? Okay.
Good.
All right, because there was more marked increase in muscle tone throughout most of the range of motion, I was still easily able to move your leg. That's again 2 on the modified Ashworth scale.
Okay.
All right, Joe, I'm going to teach you this exercise right here. This is going to work to strengthen your hip flexors, the muscles that help move your knee up and down, okay?
Okay.
This is going to be the same motion that we did to test your hip flexors. Okay, so I'm going to support underneath your leg right here.
Okay.
And I want you to tighten up the core and bring that knee up as high as you can, okay?
Okay.
We're going to do this 3 sets of 10, okay?
Okay.
All right, let's go. Good, that's 1. Fire, 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 fire. 2. Breathe in, out. Breathe in, out. One more time. Good. Relax down. All right, Joe, we're going to work on some bed mobility here. For this, we're going to start on your back and then move to the edge of the table. So this is going to increase your independence and get you ready for transferring to the wheelchair, okay?
Okay.
So what I want you to do is use your arms and your core as much as possible because you got that strong core, okay? So go ahead and come up on your elbows and then extend your arms. Using that core nice and strong, strong core, good. Now we'll use that right arm to grab underneath your left leg and move it over, good. And now the right leg, good. And now readjust your hands, very good. Now you're gonna use your right arm again, left leg comes all the way over. And now the right leg, very good. And now we would do that about 2 sets of 10, okay? So all right, and we'll head on back.
Okay.
So right arm grabs the right leg, lifts it up, good. And now right arm grabs underneath the left, just like that, yep, all the way up, good. Readjust. Now right arm grabs underneath the right leg, good. And now right arm grabs underneath the left leg, good. All right, we'll come down on the elbows, and then all the way down. Very good. So that was 5 hard reps. How you feeling?
Good.
Awesome?
Yeah.
Alright. Alright, Joe, for this exercise, we're going to work on your sitting balance, and that's going to help prepare you for when you're sitting in the wheelchair, and it's going to make that easier, okay?
Okay.
First, we're going to have both hands on the table, just like you're doing. Then as you get better, we're going to take a hand off, and then eventually we're going to go no hands, okay?
Okay.
But what I want you to do is sit here for 30 seconds, really engage that core, because that's what's going to be doing most of the work, and we're going to try to sit here for 30 seconds, okay?
Okay.
Alright, ready, go. Still breathing in and out, nice and slow. Engage the core. There you go. Alright, good. That was 30 seconds. So that was awesome. So we're going to try with one hand, okay?
Okay.
So I still want you to engage the core. So I want you to breathe in nice and slow. Deep breaths. Alright, go ahead and lift one arm. Good. Breathe in. Out. Good. In. Out. Good. Alright, 30 seconds. You can rest again. And we'll do that 2 rounds of 10, okay?
Okay.
Alright, Joe, we're going to work on transferring to a wheelchair now, okay?
Okay.
If we're able to accomplish this on your own, come over here, not sure. If we're able to accomplish this on your own, that's going to increase your independence, and that is the end-all goal, right?
Right.
Alright, so what we're going to do here is, I'm going to walk you through it real quick before we start, but you're going to slide that board underneath your hip, and you're going to push up through your arms, and then move to the middle of the board, push up again, move to the next part, and then last time into the chair, and then we'll lean over to remove the board.
Okay.
Okay? So what I want you to do is grab the board with your left hand and lean a little bit to your right, shift your weight, there you go, and slide it underneath. Good. You're making sure it has a good grip underneath you, and it's also onto the chair.
Mm-hmm.
Now what I want you to do is bring the right arm right close, or your right hand right close to your right hip.
Okay.
Left goes a little halfway through. And now what I want you to do is keep your core tight, take a deep breath in, and then breathe out, and you're going to push hard through your hands, and then lift your bottom up to the middle of the board, okay?
Okay.
On the count of 3. 1, 2, 3. Good. Okay, now you're going to reposition your legs. Very good. And we're going to do the same thing. Bring your right arm nice and close. Left arm goes to the end. And you're going to push up hard and then move over, okay?
Okay.
Remember to engage the core and breathe out as you're going, okay?
Okay.
On the count of 3. 1, 2, 3. Very good. Now what I want you to do is hook around that arm, lean over to your left, and grab the board out from underneath you. There you go, you can place it on the bed. And now push up through your hands and reposition yourself. Very good. You can move your arm back. So how did that feel doing that?
Pretty good.
Good?
Yeah.
Any pain?
No.
With that? Alright. So now we're going to move back, okay?
Okay.
So again, I want you to hook this arm around the wheelchair. Good. And you'll grab that with your right. You're going to lean over, shift your weight to your left. Good. There you go. Shift all the way underneath. Okay. So you can hook that arm back around, and now I want you to put your right hand about a little bit further down. Yep. And your left arm can go on the seat of the wheelchair.
Okay.
And on the count of 3 again, you're going to push up through your hands and move to the middle of the board, okay?
Okay.
On the count of 3. 1, 2, 3. Very good. Now I want you to move, let's actually reposition your legs first. Good. Now move your right arm to the end of the board, left arm nice and close on the board.
Okay.
Again, you're going to push up hard, take a deep breath in, breathe out, and then we'll push up, okay?
Okay.
Count of 3. 1, 2, 3. Very good. Now reposition your legs. Okay. Now I want you to lean through this right arm on your right side, and with your left, you're going to grab the board and pull it out from underneath you. Very good. Put your arms back. How did that feel?
Pretty good.
Pretty good?
Yeah.
All right. No pain or anything like that?
No.
Okay. Very good. Good job. All right, Joe, we're going to work on that 10 reps, okay, until you get nice and comfortable with it.
Okay.
All right. All right, Joe, I'm going to give you some exercises to do on the days that you don't have therapy, so it keeps your muscles working nice and strong, okay?
Okay.
The first 2 we've already done, and the last one we're going to do is new, okay?
Okay.
So for the first one, you're going to be laying on your back and then sitting on the edge of the bed, like we were doing before. Do you remember that one?
Yeah.
Okay, and we'll do that 2 sets of 10, okay?
Okay.
Just if you're having any pain throughout them, just you don't do them anymore, okay? Just throughout, I don't want any pain while you're doing it.
Okay.
Make sure to breathe in nice and slow slow in, slow out the whole time, okay?
Okay.
The next one we're going to do is the sitting balance, and you're going to hold that position for 30 seconds, okay?
Okay.
And for this one, 30 seconds 5 times. And for the sitting balance, I want you to keep both hands on the table, okay? Actually, for when you sit on the edge of the bed, I want you to keep both hands on the table too. And I only want you to do that if there's a nurse in the room and if your feet are able to touch the floor, so the bed's low enough, all right?
Okay.
And the last exercise I'm going to teach you is called heel slides. And what you're going to do is take this sheet and you're going to hook your foot around the end. So I'll let you do it, okay?
Okay.
So take the sheet and go ahead. You can use your arm to pull your leg up, and then hook the sheet around the head of your foot. Very good. Now I want you to use your top of your hip as much as possible to lift your knee up, okay?
Okay.
But your arms are just going to help you.
Okay.
So on the count of 3, you're going to keep your core nice and tight. Breathe out, and then slide your heel off the table. Good. Using that muscle. Good. Okay.
Mm-hmm.
And then you're going to use your arms to help put your leg back down where in the starting position.
Okay.
There you go. Very nice. All right. So we're going to do that one 2 rounds of 10. Again, if you're having any pain, if your arms start to get tired, just take a break from that. Okay. Joe, do you understand your home exercise program and confident that you can do that on your own?
Oh yeah.
Awesome. All right. Well, lastly, I just want to reiterate how important it is for you to check your skin while you're in bed, okay? Because of your injury and also your diagnosis of diabetes, you're going to have sensory loss or sensation loss in your lower extremities, okay? So it's real important to check your skin to make sure there's no pressure ulcers building up, because if you don't catch it quick enough, it could get infected, and then you could have your to get amputated if it gets to that level, okay? So it's very, very important. So I'm going to just teach you a couple quick ways to do that. First way is to check the bottom of your feet, and you're going to use this mirror here.
Okay.
So you're going to push up on your elbows, and then all the way up into a long sitting position, and use that mirror to stick it up to your bottom of your feet. Very good. Can you see all the way around your feet?
Yeah.
Okay. Try your other one. Very good. Okay, so now we're going to check your back, your buttocks, and your heels. So I want you to roll over to your side facing me. Very good. And now use that within your right hand to check your back, your bottom, and your heels. Push them up. There you go. Very good. Joe, do you understand how important this is to do this at least once a day?
Yeah.
Okay, very good. Now I'm going to give you this piece of paper right here. So this goes over your whole home exercise program I taught you today, and also tells you a little bit more about the skin protection and how you should be checking your skin, okay?
Okay.
Joe, do you have any more questions about what we did today, or any questions about the home exercise program, or how to check your skin, or anything like that?
No.
No? Alright, man. Well, it was great working with you today, and I look forward to seeing you next time, alright?
Sounds good.
Alright.